because of its extreme high demand and requests coming everywhere, phones getting blown off the hook, unlimited calling. People are exhausted with fulfilling the demand or trying to fulfill the demand and answering the questions. This is a big reason why some doctors are turning their heads. And they're probably relieved once a patient actually meets their A1C level or a patient meets an appropriate BMI. Because then now they want to breathe a little bit. They want to slowly usher you off of the medication. Something I introduced in the beginning of my GLP1 brand medication journey when I started off on Zepbound before transitioning to Tirzepatide compound. Doctors may no longer prescribe brand name GLP1 medications such as Zepbound, Mounjaro, Wegovy, Ozempic, Trulicity, Victoza, Saxenda, unless the BMI is at the appropriate level. If the BMI has been reached, so let's say the BMI starts off at a high level, eligible for brand name GLP-1 medication and even non-brand, compound medication. As far as the brand name medication approval and the continuation of the prescription for maintenance is looking less likely. It's looking like doctors are considering a correct BMI as completion. So once the BMI has reached the appropriate level, doctors are considering that as completed treatment and to move forward with the patient's own individual maintenance methods to maintain their weight loss. And I mean, this also is considered for diabetes patients. So if you're prescribed specifically diabetic medication, if your A1C levels are correct and there's a history of your A1C levels regulated, putting you out of the diabetic category, some doctors may no longer provide or prescribe the diabetes medication. And what is the reason for this? A lot has to do with the tyranny of getting these medications approved. And it has a lot to do with the prior authorization burnout process. And I think that's what a lot of these clinicians, physicians, doctors, all of the staff are experiencing. I know I had picked up that vibe when I was going through my situation on obtaining approval for the brand name medication. The constant re-entering and resubmitting prior authorizations, including information that was already included, or missing information on technicalities, and then having a denial letter sent, and then that starts the process all over again, requiring the physician or the clinician to resubmit another prior authorization request, further delaying the time, going into appeal, and this stuff starts to get repetitive. I honestly pick it up when I was going through what I was going through, having my doctor constantly resubmit prior authorizations. I can't tell you, I probably submitted about, I know it was probably more than on one hand, okay? And it just came back at a point of frustration from my own primary provider that, listen, they're not approving it. And a lot of patients are experiencing it at my same doctor's office. So I think that's leaving a bad taste in these physicians' mouth, unfortunately. Although they want to provide this medication, the script for it, because they know it's beneficial and it's appropriate for a lot of patients who are struggling with chronic obesity and who's also struggling with diabetes, who are overweight or diabetes and non-overweight. This medication treats diabetes and it treats chronic weight management off-label for some brands. And of course for the chronic weight management approved brands on label. But it's looking like the doctors are becoming weary. The process is burning them out to the point where it's like, you know what, some staff is just discontinuing running PAs for brand GLP1 medication. I mean, unless it's almost a certainty, a medical necessity deemed for this patient, then they'll run the PA. But it's looking like doctors are becoming very hesitant when that request of a prescription for GLP-1 medication comes across their desk or their path or comes out one of their patients' mouths. I think their idea is this is going to be a grueling process and it may not even be beneficial for the patient, because if the doctor approves the prescription, that's the first part. But then now the insurance has to approve the medication. That's the second part. And usually that's where the delay comes in. The intervention comes in at the second tier when insurance needs to cover it. That's when the denials come in. So from my experience, most of the time, the doctors and physicians are on board if it can just be something easy and procedural as just sending a form like it should be with your information on it and the qualifying factors. But it's not. It's becoming a very meticulous and detailed process and somewhat contradictive, because some of the requirements that are expected to be completed on PAs will be completed, but then somehow you'll get denials saying this, that, and the third wasn't included. So it's like a back and forth, tit for tat, find error somewhere or create a concern for a need for resubmission for some reason, just so that could constitute the denial. This is what's going on in this insurance approval world for brand name medication, which is driving people into the compound market. I don't know if Eli Lilly took this in consideration, possibly, which is probably part reason why he incorporated a streamlined system of services in which Eli Lilly providers, etc., control the distribution and the approval of these medications, coming directly from them to try to cut out the red tape of the middlemen and, you know, all of that. Just deal with the prescription from the physician and then send it straight to Lilly, and they want to deal with it from that point, let them do all the work. I can see why that has been a move for Lilly, because there is resistance from GP, general practitioners, from PCP, primary care providers. This is delaying some of the prescriptions for Lilly, which over time, can show a mark in the revenue bin. All right, shows a mark in the revenue bin because it's a delay. So I see this Zepbound vials coming out as an opportunity to try to retrieve another market and try to retrieve some more revenue for the non-insurance payers, for the self-payers, which is of many. But what are you going to do if this happens to you? You come in encounter with a physician who doesn't want to pursue this prescription in your favor for some of the reasons that I've listed. As a patient, that would make me uncomfortable. I would feel some type of way, because at the end of the day, you're still, my provider, and I will want you to do everything in my best interest, right? So if you come into a provider who has pretty much a disdained attitude about GLP1, if you bring up brand name GLP1 medication, you get some type of vibe or a negative type of connotation, or some type of nonchalant type of response. Nothing like gratifying. Nothing like, a patient really would need, as far as a physician actually digging deep and inquiring about it and actually having a discussion about the medication, the side effects, why do you think you need the medication, having that one-on-one consultation with the patient, which is 100% needed, but often not thoroughly conducted with these PCPs and GPs. Because honestly, a lot of these providers, they're focused on just the main system of ailments that come through their office, the situations that they deal with on a regular basis. And most of those situations are not GLP-1 brand weight-related situations. They're dealing with other patients and patient ailments and standard procedures and routines and all this type of stuff. So when you come in with the brand name GLP-1 requests, it's almost like, I think the idea is a daunting idea for some of these physicians. It's almost as if they're not enthused anymore, and maybe they were enthused at a point but lost enthusiasm as they have seen the type of responses that have been given back through these prior authorization requests.
AJ, come here. Come here.
So, I saw this coming in anyway, because I kind of predicted this when I did one of my videos way earlier in the beginning of my journey. And I'm just wondering, at some point, when it comes to maintenance, these physicians are not even going to pursue that fight. Now, it's one thing for them to pursue the fight to initially get the medication, and you have the BMI of approval, comorbidities or whatnot, right? They at least owe you that effort, a part of the oath, right? But it's a whole nother thing when factoring in this medication for maintenance use. I actually want y'all to tap in. Let me know if you are on brand name GLP-1 medication, Zepbound, Mounjaro, Wegovy, Saxenda, Ozempic, Trulicity, Victoza. any of these brand name GLP-1s, let me know if you are in maintenance and are able to successfully refill your maintenance requests through approved PAs. Or are you having difficulty and PAs are denying the medication for maintenance? This is what I was in fear of. The maintenance component, which has been thoroughly outlined in the expectations of Lilly's medications, okay? That the GLP-1 medication in general can be used as a lifetime medication for treatment of chronic weight management and diabetes. And just for example, just because someone who had hypertension, high blood pressure, happened to get their blood pressure down to a manageable level, does not necessarily mean that they do no longer need the hypertension medication to sustain and maintain those levels. It is the same parable for an individual who needs Zepbound or something relative to that for chronic weight management, or who needs Mounjaro for A1C level management in addition to chronic weight management, because it can do both. Tirzepatide can regulate your A1C levels and also provide weight loss. Semaglutide can level your A1C levels and also provide the effect of weight loss. But no matter how much this intention of maintenance is pushed, it doesn't seem like the medical industry is receiving it. So, as these medications continue to go into shortage, and there are the ins and outs on what's available and what's not, people going to compounds, people trying to stockpile pens and doing compounds on the side, trying to have a healthy variety of both in case they can no longer get the brand medication for a while due to denials and or shortages. And you have the compound market. This is why the compound market is not going anywhere. Trust and believe. The GLP-1 compound market is, I believe, is not going anywhere. It's just, honestly, it's better to deal with telehealth providers now. The telehealth providers who have primary care physicians on deck to provide assistance with prior authorizations for the brand name GLP-1 medication, and then also give you accessibility to the compound medication. You have tons of them. Fridays is one of them. Row is one of them. Plush Care is one of the providers. There are many providers that do advocate for both medications, the brand, and then as a last resort, give the compound if that's your choice. And honestly, this is probably the better route to go than going through your standard brick and mortar doctor's offices and consulting with your primary physician, because you may not get the type of response you think you're going to get. You may not get the welcoming response, the let's consult, let's figure this out, let's see what options are out there for you. You know, the dig deep into my doctor's appointment type conversations is what you're looking for as a patient. With this GLP-1 medication, unfortunately, because of its extreme high demand and requests coming everywhere, phones getting blown off the hook, unlimited calling, people are exhausted with fulfilling the demand or trying to fulfill the demand and answering the questions. This is a big reason why some doctors are turning their heads. And they're probably relieved once a patient actually meets their A1C level, or a patient meets an appropriate BMI. Because then now they want to breathe a little bit. They want to slowly usher you off of the medication. You don't no longer want to prescribe the medication. I mean, if anything, they will prescribe something that's, non-GLP1 relative, but to aid. But as far as it being a GLP1 brand medication, they're not looking to do that. They're looking at this as an end of treatment, a successful completion of treatment, and to move forward with positive, healthy habits, lifestyle habits. And that's really what it is supposed to be initially, right? But we want it to be long-term. Unfortunately, a lot of patients need this long-term. Me being one of them, need long-term GLP-1 medication use as maintenance. I'm currently in maintenance. And if you take the time to go through my channel, I definitely post avid videos on my maintenance updates and how I'm maneuvering between unit dosing through split dosing, and just the ups and downs of dealing with food noise and trying to maintain this weight and seeing the fluctuations and possibly seeing those fluctuations continue if I choose to stop this medication. So honestly, it's really science available proving that this is needed. And we already know that the typical science that's been pushed down our throats all over the place, that most people taking GLP-1 brand medication, once the brand medication is no longer being taken, that the individual will gain the weight back. Maybe not all the weight back, but a portion of the weight back. And this does not apply to all, because there is a percentage of those who successfully are able to practice the right lifestyle routines that they have been practicing while on the main medication, and continue it off and still able to maintain their weight loss for a year or so. So it's definitely possible. It's still, at the end of the day, a brain thing, a mental thing, control over food, understanding when to stop eating, understanding how much to eat, all that. So GLP-1 is really needed for those components. But I see us running into hurdles for those who are trying to get this approved through insurance. So I don't know, some people are trying to drag out their BMI. I mean, I'm just throwing it out there. It's reason now people are slowing down their progress. I think people are slowing their progress down intentionally so that they can continue to be approved for brand name GLP-1 medication. They want to slow walk it. As long as you keep that BMI high, then you can continue to get the medication. But if that's the case, and that is the strategy, what are we really doing here? What's really going on? Are you really making progress, or is it just trying to sit on a medication for as long as you can? As if we are afraid of results. We are afraid of separation. We are gaining separation anxiety. So the idea of possibly separating from the GLP-1 medication is causing anxiety. I think it's something that a lot of brand users are not looking forward to. But if the strategy is just to ride on the medication and keep your BMI at the eligible level, what good are you really doing yourself? Just so that you can keep getting approved. You're still not making the progress. Yes, you will continue to be approved for the medication, hopefully. if they didn't find a gray area somewhere. Because, you know, even within these prior authorizations, you can be a BMI, but if they look over your history and see that you've been this BMI for too long and you had this medication and you're showing really no progress, that could possibly be a discontinuation of medication. So like, you gotta really be mindful of that, even with these strategies to preserve the approval of Zepbound, Mounjaro, and all the rest, okay? Don't try to keep yourself at a weight that you know you don't need to be at just so that you can continue to have the medication, because that may not even work out well for you as well. You end up being without the medication because of the lack of progress, and that's all determined by your insurance provider, who gets the information from your primary provider or your physician provider through whatever medical service you're using. So essentially it is, at the end of the day, if you run into this situation, just get a new doctor, consult. You're gonna have to do your research. You're gonna have to consult with a new doctor, provide that doctor with GLP1 use history and your medical history, to include, you know, your weight-related ailments and comorbidities. It'll take a little time, it'll take a little research, but you may have to just look into attaining a new doctor so that you know, can get better results and a more comfortable feeling and a better level of enthusiasm when it comes to retrieving this medication that you need help from several parties to do. I don't know, I just found this interesting. Maybe something for you guys to think about as you are on your brand GLP-1 journeys, as you are on your compound GLP-1 journeys. We ain't got to worry about none of that really in the compound market, because we covered and cleared over here, okay? We covered and cleared, which is kind of a relief. Although I'm paying more money and not paying that cheap amount of money that I want to pay for the brand, I'm kind of really appreciating the compound, because it X's out all of the headaches, all of the nonsense that I was going through, all of this red tape and bureaucratic nonsense that's driving denials and causing anxiety and causing the inability to sustain these medications for a population who clearly needs it. So I'm glad I'm a part of the compound market, and I suggest you become a part of the compound market as well. It's still up and going, it's rolling, rocking and rolling, and I know my telehealth provider is going to remain rocking and rolling, okay? Hope this suits you some, y'all. I will see you in the next video. Be real.